Hello everyone. Today we are going to talk on the importance of thoracic mobility and its relevance to the shoulder movement and your rib cage movement. Okay. Now what do I mean by thoracic mobility? This is our spine. Okay. So this is our neck. This upper portion is our neck. Okay. So 7 vertebrae in the neck. Thoracic spine is the spine which is between the neck and the low back. So this between portion, there are 12 vertebrae which are there, which form the thoracic spine. Mobility of this thoracic spine is very important for your chest and for your shoulder movement. I will explain you how in this video. Starting with your chest mobility. Now as you can see, there are 12 spines here, 1, 2, 3, 4 and like that till 12. All these 12 spines are connected to the rib cage in front. So we can see the ribs come like this from the joint here, which they form as the costotransverse joint. Okay. Now that is the name of the joint which is given as it connects the rib of your chest. Okay, so 12 vertebrae connecting the 12 ribs of yours. So movement in the joint here is directly proportional to your rib cage expansion. Okay, it just works like a simple knee joint. So if you move your knee, the kneecap goes up and down. Similarly, your knee can flex and extend. Similarly, in this position, if you are taking a deep breath in and out, you will see the movement happening here in these joints. Due to any pathology or stiffness, if the movement here in this costotransverse joint is restricted, then automatically you feel symptoms in front. That is heaviness, breathlessness. At times you feel referred pain going down your arm as well, and it can be confused as someone having a heart problem or a chest problem, but sometimes it's just a pure musculoskeletal problem. Some people also feel pain. I feel pain in my left hand which is radiating down, so people feel that I've got a heart attack. Okay, but sometimes it's just a stiff joint here. Some people feel pain similarly in the left hand. Now that could be because of herpes also, and as we know in shingles or herpes, the stiffness of the joint which is there is this costotransverse joint. Okay, so that is how it is very important for this joint to be in full mobility, to have a good chest expansion. Okay, now turning to the shoulder mobility. Now as we can see the spine here, now this is where two spines are connected. Now these are called as the facet joints. Okay, we talked about the costotransverse joint, and now these are called as the facet joints. Where facet joints is where basically the two spines connect with each other. Now the shoulder is somewhere here. So if I want to move my shoulder, there has to be a 4-degree extension happening in my thoracic spine. 4 degrees is a subjective marker in academic point of view. Point being, there has to be an extension happening. That means the joint has to move like this, and especially the upper thoracic spine till your T1 to T6 is where you should be feeling the extension happening. Most commonly, when we see the end range movement restricted, frozen shoulders, stiff shoulders, and no muscular injury, and people, physios, tend to get confused. Okay, where is this pain coming from? So this is where the stiffness is. In our practice, we commonly find the stiffness, and our first line of treatment is to first attack the D spine stiffness or the thoracic stiffness. So T1 to T6 is where the stiffness comes in, especially in the facet joints. Mobilizing this T1 to T6 vertebrae in itself opens up your shoulder range immediately. So your impingement cases, your frozen shoulder cases, people who feel I cannot lift my arm beyond an angle and I feel a pain, that is not a pure shoulder pain, but it is a pain which is biomechanically referred because of your stiff D spine or thoracic spine. Last point I would like to address is a thoracic spine which is stiff can radiate pain which is similar to a neck pain as well sometimes. Say for example, a T3 or a T4 facet can sometimes refer pain to your arm in the radial nerve direction. So like this. Okay, so that can also be, so and some people feel, oh, I've got neck pain, but it is the T3, T4 facet also which needs to be taken care of. So 3 aspects: chest mobility, shoulder mobility and referred pain because of your thoracic mobility. So importance of thoracic mobility I have tried to summarize in brief in this short video.